What if I told you that one of the most overlooked reasons so many adults over 60 struggle with tingling, numbness, or burning sensations in their feet and hands has nothing to do with just getting older, and far more to do with how the nervous system quietly changes over time? I know that may sound too simple. Many of my patients have said to me, "Doctor, I've heard this before." Or, if it were that easy, someone would have told me years ago. And I understand that skepticism completely, because when discomfort has been lingering for months or even years, simple explanations can feel almost insulting. My name is Dr. Linda Harrison, and for the past 23 years, I've worked closely with men and women in their 60s and 70s, listening to their concerns, examining their symptoms, and helping them understand what is happening inside their bodies. One of the most common worries I hear is about nerve-related discomfort. Sometimes it starts as a mild pins and needles feeling. Other times, it's numbness that makes walking feel uncertain, or a burning sensation that becomes most noticeable at night, when everything is quiet and there are no distractions. What's important to understand is that nerve health plays a central role in how we move, how we balance, and even how safe we feel in our own homes. After the age of 60, small changes in nerve function can have outsized effects. A bit of numbness in the feet can increase the risk of falls. Subtle loss of sensation in the hands can make everyday tasks frustrating. And when these symptoms persist, they often come with worry, confusion, and the fear that things will only continue to get worse. Many people assume neuropathy is an unavoidable part of aging, something to be endured rather than understood. Others blame themselves, thinking they must have done something wrong years ago. In reality, aging brings a unique set of biological shifts, and the nervous system is especially sensitive to them. Nerves are long, delicate structures, and maintaining them requires consistent internal support. Over time, that support can quietly diminish long before obvious symptoms appear. I've met countless patients who did everything they thought was right. They stayed active, tried different diets, followed advice they heard from friends or read online, yet still felt frustrated when nerve symptoms didn't improve. That frustration can turn into resignation, and resignation can turn into silence. People stop talking about their symptoms because they assume nothing can be done, or they worry they won't be taken seriously. This topic matters so deeply after 60, because the earlier we understand what contributes to nerve changes, the better we can have informed conversations with our healthcare providers. Education does not replace medical care, but it empowers you to ask clearer questions and recognize what deserves attention. Nerve discomfort is not just a physical sensation. It affects confidence, independence, and peace of mind. And no one should feel dismissed or hopeless simply because of their age. Today, I want to begin by acknowledging your experience. If you've noticed changes in sensation, you're not imagining them. If you've been told, that's just part of getting older. It's understandable that you might feel discouraged. My goal is not to promise miracles or quick fixes, but to help you better understand why nerve health deserves careful attention in later years, and why certain factors can play a protective role when it comes to the nervous system. As we age, our nervous system goes through gradual, very real biological changes, and understanding these changes can make nerve symptoms feel far less mysterious. Nerves are like long electrical cables running throughout the body. They carry signals from the brain to the muscles and back again, allowing us to feel temperature, pressure, pain, and position. For those signals to travel smoothly, The nerve needs both a healthy internal structure and a protective outer layer. One of the most important structures involved is something called the myelin sheath. You can think of myelin as the insulation around an electrical wire. When insulation is thick and intact, signals move quickly and clearly. When it becomes thin or damaged, signals may slow down, weaken, or misfire. This is when sensations like tingling, numbness, or burning can appear. After age 60, the body's ability to maintain this protective coating naturally declines, especially if certain nutritional supports are not consistently available. Another key mechanism involves energy production inside nerve cells. Nerves are surprisingly energy hungry. Every signal they send requires fuel, much like a car needs gasoline to run smoothly. With aging, the body becomes less efficient at converting nutrients into usable energy at the cellular level. When nerve cells don't get enough energy, they struggle to repair themselves and communicate properly. Over time, this can contribute to the gradual development of neuropathic symptoms. There is also the issue of signal clarity. Inside the nervous system, chemical messengers help signals pass from one nerve cell to the next. These messengers must be produced in precise amounts and cleared away efficiently. Certain vitamins play a role in this delicate balance. When levels drop too low, signals can become distorted, much like a radio station filled with static. The message still gets through, but it's unclear and uncomfortable. Aging also affects absorption. Even when someone eats well, the digestive system may not absorb nutrients as effectively as it once did. Stomach acid levels can decrease, and changes in the gut lining can limit how well certain vitamins are taken into the bloodstream. This means that over time, nerve cells may receive less of what they need, even without obvious dietary changes. This gradual shortfall often develops quietly, long before symptoms are noticeable. Finally, there is the role of inflammation and repair. Low-grade inflammation becomes more common with age and can interfere with the body's natural maintenance systems. Nerves, being long and delicate, are particularly sensitive to this environment. Without adequate internal support, small areas of damage can accumulate, leading to more persistent sensations over time. When you put all of these processes together, nerve discomfort after 60 begins to make sense. It is rarely the result of a single sudden problem. Instead, it reflects a combination of reduced protection, lower energy availability, altered signaling, and less efficient absorption. Understanding these mechanisms helps explain why nerve health is so closely connected to specific nutritional factors, and why supporting the nervous system becomes increasingly important as we grow older. I think of a woman I once cared for who was 72 years old and had always considered herself steady and independent. She told me that the first thing she noticed was not pain, but uncertainty. When she stood up in the morning, her feet felt distant, as if they were slightly disconnected from the rest of her body. She could still walk, but she hesitated. She found herself looking down more often, holding onto furniture, and avoiding evening walks she once enjoyed. What troubled her most was not the sensation itself, but the quiet question in her mind. Why is this happening when I haven't changed anything? She tried to describe the feeling in her own words. Sometimes it was a gentle buzzing, other times a dull numbness that made the floor feel unfamiliar. At night, the sensations became more noticeable, not because they were suddenly worse, but because everything else was quiet. She told me she felt frustrated and even embarrassed, wondering if she was simply being overly sensitive. When friends said, That's just part of getting older." She nodded, but inside, she felt dismissed. I also remember a man in his late 60s who came to see me because of changes in his hands. He had worked with tools for most of his life and took pride in being precise. Over time, he noticed that small objects felt different. Buttons were harder to manage. Coins slipped more easily between his fingers. He described a faint burning sensation that would come and go, leaving him unsure whether he was imagining it. What upset him most was the loss of confidence. Tasks that once felt automatic now required effort and concentration. Both of these individuals shared a common experience: confusion. They hadn't suffered an injury, and there was no clear moment when everything changed. Instead, symptoms crept in slowly. When we talked, I explained how nerve cells rely on protective coverings, steady energy, and clear signal transmission. As those systems gradually weaken with age, sensations can become distorted. Hearing this helped them understand that their experiences were not random or imaginary, but connected to real physiological changes happening quietly inside the body. What stood out to me in these conversations was the emotional weight of uncertainty. When people don't understand why something is happening, they often assume the worst. They worry about losing independence or becoming a burden. Yet when the science is explained in clear, simple terms, there is often a sense of relief, not because everything is suddenly resolved, but because the mystery is gone. Understanding brings a feeling of control and reassurance. These stories are not unusual. They reflect what many adults between 60 and 80 experience as nerve function changes over time. The sensations may differ, but the underlying concern is often the same: a desire to feel steady, capable, and understood. When we connect real-life experiences to how the nervous system works, it becomes easier to see these symptoms not as a personal failure, but as part of a larger, understandable process. As you think about nerve health in daily life, the most important place to begin is with awareness. Pay attention to small changes that may seem easy to dismiss at first. Sensations like mild tingling, occasional numbness, changes in balance, or differences in how your hands and feet feel are not signs of weakness, and they are not something to be ashamed of. They are simply signals from the body asking to be understood. Noticing patterns, such as when sensations appear, or how they affect your routine, can provide valuable context when speaking with a healthcare professional. One common misunderstanding is the belief that nerve-related symptoms must always be severe to matter. In reality, nerve changes often develop gradually. Many people wait until discomfort becomes disruptive before mentioning it, assuming earlier signs are insignificant. Another misconception is that all nerve symptoms mean the same thing. Tingling, numbness, burning, and altered sensitivity can each have different underlying contributors, which is why careful evaluation is so important, especially later in life. It is also important to remember that nerve health does not exist in isolation. Other age-related changes in circulation, digestion, and metabolism can influence how the nervous system functions. This is why well-meaning advice from friends or the internet, even when it sounds convincing, may not apply to your individual situation. What is helpful for one person may not be appropriate for another, particularly when existing medical conditions or long-term medications are involved. I want to be very clear and reassuring here. No medication, supplement, or long-standing treatment should ever be stopped or changed without first speaking with a qualified healthcare provider who knows your medical history. Decisions about health after 60 require balance and context. What matters is not just addressing one symptom, but protecting overall well-being and safety over the long term. A thoughtful conversation with your doctor allows benefits and risks to be weighed carefully, with your individual needs in mind. If nerve-related sensations have been part of your life recently, approaching the topic with curiosity rather than fear can make a meaningful difference. Understanding how the nervous system changes with age allows you to participate more confidently in your own care. Asking questions, sharing observations, and seeking clarity are all reasonable and responsible steps. My hope is that this information helps you feel informed rather than overwhelmed. Nerve health is an important part of aging, but it does not define you, and it does not remove your ability to make thoughtful, safe decisions about your care. You deserve to feel heard, supported, and respected at every stage of life. This is Dr. Linda Harrison, reminding you that understanding your body is a powerful form of self-care, and that careful, informed choices are the foundation of long-term health and peace of mind.